If you or someone you care about is suffering with complex regional pain syndrome, CRPS, you're likely looking for almost anything that gives this person relief and/or will help them recover from this complex and life-altering condition. In today's dive, we're going to be talking about the effect that hyperbaric oxygen could have on somebody suffering from CRPS. I'm Dr. Jason Saunders, and I've been using hyperbaric oxygen in my clinics for nearly 2 decades, and we've treated dozens and dozens of patients with CRPS. Let me first start with the idea that hyperbaric oxygen is not the cure or even a direct treatment for conditions like CRPS. However, many patients with these conditions seem to respond favorably, and there's a number of reasons why, and that's what we're going to be talking about in today's video. So what is CRPS? It's severe and persistent pain in an area typically following a traumatic experience, whether that was the injury itself or sometimes while the injury itself was traumatic, there's then follow-up surgery or surgeries to try to repair a particular injury, and the cumulative impact of the trauma from the injury, but then the trauma from the surgery or surgeries is what triggers this neurological increase in pain in a particular area. These patients are often very sensitive to touch, but also sensitive to temperature changes. We may also see vascular changes in that area and/or color changes in the skin around this area. This is sometimes accompanied with swelling, but other times the tissue may even look normal, but the patient is feeling a severe heightening of pain sensations. There's nervous system dysfunction, there's central sensitization, there's changes in the circulatory system, and often chronic inflammation is present. Symptoms often begin hyperlocally in an area of trauma. Symptoms may spread or evolve over time. One of the reasons CRPS is complex is because in some cases, the tissue even appears to be healing, but the pain levels still remain heavily escalated. What also makes it complex is it often includes a number of different systems: the vascular system, the neurological system, the immune system. And so a number of systems are impacted by CRPS, making it more difficult to understand the exact pathway to healing and recovery. So, why is hyperbaric a potential strategy for somebody with CRPS? Hyperbaric, while a pretty simple therapy, happens to impact a number of different systems and impact the exact same systems that somebody with CRPS is suffering from. With CRPS, we know we have elevated levels of inflammation. With hyperbaric, we know that there's a systemic decrease in the inflammatory cytokine response, meaning hyperbaric causes a systemic reduction in inflammatory cytokines. We also know that hyperbaric stimulates the anti-inflammatory pathways inside of our body, helping to cause a much greater balance inside the immune system overall. We know that people with CRPS have compromised vasculature. In other words, there's damage to the microcirculation and therefore damage to the oxygenation of those tissues for healing purposes, as well as the carrying away of waste products inside that damaged tissue. We know that hyperbaric stimulates new blood vessel growth. That's a hallmark of the hyperbaric treatment. As we stimulate new blood vessel growth and healing of the endothelial lining of the blood vessels we have, we start a process of delivering oxygen to that hypoxic and potentially necrotic tissue, as well as helping to carry away all of those waste products, decreasing the inflammatory response in the local area. Whether from nerve damage or through central sensitization, which is a heightened interpretation of pain at the brain center, we know that hyperbaric balances the nervous system. We know that hyperbaric stimulates neuroplasticity and improves synapse connections inside our neurology. We know that hyperbaric helps to stimulate central nervous system stem cells to migrate into an area that was injured for healing and recovery. So as I said earlier, hyperbaric's not a treatment for CRPS. However, if we understand the pathology of CRPS and we understand the mechanisms of action of hyperbaric, then we can start to understand, is this tool appropriate for using with somebody suffering from these issues? In my clinical experience, I could absolutely say yes. We've used hyperbaric oxygen repetitively for people with CRPS with incredible results. There have been a few studies on hyperbaric oxygen and CRPS. One of the more recent ones was done in 2025, looking at the effect of hyperbaric oxygen on patients with CRPS. Now, in this particular study, they broke patients into 2 different categories: those that had sympathetic dominant pain and those who had pain independent from the sympathetic system, meaning those patients with sympathetic maintained pain had changes in their autonomic nervous system leading to some of this heightened pain response, while the other ones did not. But in both cases, there was still a significant increase in their interpretations of pain signals at the brain level. In this analysis, which was really looking at 13 different studies and over 280 different patients that were being treated, the overwhelming majority of them had symptom relief, especially from a pain management standpoint. Now, the therapies ranged in terms of pressure, the therapies ranged in terms of number of sessions. So some of these studies only did 3 to 5 sessions. Some of these studies did 40 to 60 sessions. Most of them were done at 2 atmospheres or above, but the overall findings across all of these different studies showed statistically significant improvement in patients' symptomatology after undergoing this range of hyperbaric protocols. While I have not seen any studies on hyperbarics for CRPS at lower than 2 atmospheres, I would say clinically, to me, that doesn't mean lower pressures wouldn't work. And in fact, when there are autonomic nervous system imbalances in CRPS, which I would also say similar to things like chronic fatigue or fibromyalgia, where a lot of the clinical trials have been done at higher pressures, not all the patients tolerate higher pressures well, especially in the beginning. And so for that reason, I would say that when we're trying to reduce inflammation, which we are in this case, we know that lower pressures are great at reducing inflammation. When we're trying to stimulate neurogenesis, which again we know is done at lower pressures and higher pressures, for most of these cases, I would start at lower pressures first anyway. For me, looking for the minimum effective dose is what I'm always trying to accomplish. What's the least amount of a therapy I need to offer to get the maximum result? And so starting at lower pressures, because that's going to be more comfortable for most of these patients, and then while increasing frequency and duration, only increasing pressure if it appears that this patient's not responding to the pressures that we're using in the first place. Regardless, to only do 5 or 10 sessions in cases like this would not be doing it justice. In almost every case of CRPS, we're not doing less than 30 to 40 hours, and many times it's closer to 50 to 60 hours. And those 50 to 60 hours are likely to be done over 3, 4, even 5 months. My experience with working with those folks who are affected by CRPS, I know that this is a long, daunting, and often frustrating road. While hyperbaric may not be a cure or a direct treatment for CRPS, as I've said, and as the literature shows, hyperbaric can certainly help in the recovery process. And I hope this gives you a place to start and some hope for the journey ahead. I appreciate your time. Thanks for diving with me. I'll see you on the next video. If you're a practitioner or you're looking to get into hyperbarics and you're wanting to learn more and making sure that you're offering this therapy as effectively and as safely as possible, I want you to know that we offer a series of courses, some of which are online and some of which are in person. At thehbotcourse.com, we'll include a link below. We have several courses available, from training and certification in hyperbaric medicine, safety director, as well as a few different business implementation options to get the business up and running. So if you think that training and education would be helpful for you, take a look at thehbotcourse.com. Again, the link will be in the description below.